Genital herpes is a sexually transmitted infection caused by the herpes simplex virus. There are two types of HSV that can cause genital herpes: HSV1, which is commonly associated with oral herpes but can also cause genital herpes through oral genital contact, and HSV2, which primarily causes genital herpes but can sometimes cause oral herpes as well. Symptoms can vary widely. Some people may have no symptoms, while others may experience frequent or severe outbreaks. The initial outbreak, or primary infection, may include painful blisters or sores around the genital, anal, or mouth areas, painful urination due to sores near the urethra, itching or discomfort in the genital area, flu-like symptoms such as fever, swollen lymph nodes, and muscle aches, tenderness or burning sensation, and the blisters may break open and turn into painful ulcers that can crust over and heal after 2 to 4 weeks. After the initial infection, the virus can remain dormant in the body, typically in the nerve cells, and recurrent outbreaks are usually milder, often triggered by factors like stress, illness, hormonal changes, or immune suppression. Outbreaks tend to be shorter and less severe with each recurrence. Genital herpes is primarily spread through direct skin-to-skin contact during sexual activities, including vaginal, anal, and oral sex. It can be transmitted even when there are no visible symptoms, which is why it is important to take precautions even in the absence of outbreaks. HSV1 is commonly spread by oral to genital contact, meaning oral sex with someone who has cold sores can transmit the virus to the genital area, while HSV2 is primarily spread through genital to genital contact but can also spread to the mouth and face through oral sex. The virus is contagious even when sores are not present because it can shed from the skin. To diagnose genital herpes, a healthcare provider may conduct a physical examination, or a doctor can often diagnose herpes based on the appearance of visible sores, or perform laboratory tests, such as a swab from a lesion tested to detect the herpes virus, which is most accurate when the sores are fresh. Blood tests can detect antibodies to HSV1 or HSV2, confirming previous exposure to the virus, even if there are no active symptoms, but a blood test is not typically used to diagnose active genital herpes. While it may not be possible to completely eliminate the risk of transmission, several measures can help reduce the likelihood of spreading or contracting genital herpes. Using condoms consistently and correctly during sexual intercourse can reduce the risk of transmission, though it does not eliminate it entirely, as herpes can spread from skin areas not covered by a condom. If you or your partner has active sores or symptoms, it is important to avoid any sexual contact until the sores have healed. People who have frequent outbreaks may be prescribed antiviral medications like acyclovir, valacyclovir, or famciclovir, which can reduce the frequency of outbreaks and the risk of transmission to others. For individuals with frequent outbreaks, daily antiviral medication can reduce the risk of transmitting the virus to a partner. Open communication with sexual partners about the infection and potential risks can help reduce transmission. Since HSV is spread through direct contact, it's important to avoid touching sores and wash hands thoroughly after any contact with infected areas. Key takeaways include that genital herpes is caused by the herpes simplex virus, with HSV2 being the most common cause of genital infections, though HSV1 can also cause genital herpes. It is often asymptomatic, but when symptoms do appear, they include painful sores or blisters in the genital area, pain during urination, and flu-like symptoms. The virus is primarily transmitted through skin-to-skin contact, and outbreaks can recur, though they may become less severe over time. While there is no cure for genital herpes, antiviral treatments can help manage outbreaks and reduce the risk of transmission. Preventative measures include using condoms, avoiding sexual contact during outbreaks, and possibly taking antiviral medication to suppress the virus. If you suspect you may have genital herpes or are concerned about your risk, it's important to see a healthcare provider for proper diagnosis and advice on management.